fetal alcohol spectrum disorder. This is going to be the topic for today's episode of Side Talks 2.0. I will be interviewing two prominent scientists to talk about their research on how exposure to alcohol during pregnancy could impact the development and growth of the brain. So stay tuned for an exciting and informative interview. Hello and welcome everybody to another exciting episode of Side Talks 2.0. As always, my name is Dr. Jack Seksenyan, and today I'm excited to have two very wonderful guests to talk to us about an important topic related to fetal alcohol syndrome disorders. I will allow them to introduce themselves and then we'll get on with the topic of our discussion. So with that, please introduce yourselves, Dr. Kelly Huffman and Dr. Olga Kozanian.
Hi, I'm Dr. Kelly Huffman, and I'm a professor in psychology and neuroscience at the University of California, Riverside. And I study in my laboratory fetal alcohol spectrum disorders in mice. And we use a rodent model to look at molecular brain development and behavioral development in our model of fetal alcohol disorders, which is present in humans after maternal consumption during pregnancy. Olga?
Hello, so my name is Olga Kozanian, and I actually received my PhD from Dr. Kelly Huffman's laboratory. So all my training, my doctoral training was done in Kelly's lab. So my dissertation was pretty much on fetal alcohol syndrome disorders. I'm currently a postdoctoral fellow at Scripps Research in La Jolla in the Weiss lab, and I study alcohol addiction and relapse.
All right, wonderful. So as you guys both have a very strong background in this topic, I just wanted to have one of you introduce to us and the audience about what is fetal alcohol syndrome and why they should care about this and why it's important to know about something like this.
Okay, so about 40 years ago now, people started talking about the effects of maternal drinking during pregnancy on the offspring, on the baby, on the child. And early on, there were some significant phenotypes that were observed in children born to drinking mothers, typically alcoholic mothers. And what led from this was an understanding and really a diagnostic criteria which was termed fetal alcohol syndrome. So that is the first term that was used. What we've learned since then is that it's really a spectrum disorder. And what I mean by that is, depending upon the dose of the alcohol that the mother took in during her pregnancy, there's going to be a lot of variability in how affected the child is. So you could imagine then if a pregnant woman drinks sort of smaller amounts, or maybe has occasional binge drinking, that this would produce some phenotype, but maybe not complete mental disability, right? Whereas more severe cases, when you have an alcoholic mother who's really consuming copious amounts of alcohol during her pregnancy, maybe on a daily basis, that's going to show really what we now term as fetal alcohol syndrome, which is really the more severe form on that spectrum. And that will accompany itself with facial phenotypes, some problems with actual facial development, along with a lot of behavioral problems that the child has. So, you know, I became interested in this because actually, you know, my mother was a neonatal nurse in a NICU. And she experienced a lot of children who came in when their mothers had been either doing illicit drugs or alcohol. And what was interesting to me was that the more severe long-term outcomes for some of these children was with alcohol, not with heroin, where they would be born terribly addicted, but then they would be able to recover, and then having actually less long-term outcomes than what alcohol seemed to do in developing brain. So I really became interested in that, like what was the mechanism by which alcohol could impact the offspring in such a significant way to cause really in many cases, severe mental retardation or severe mental disability, and that a lot of these phenotypes that would last lifelong. So what was the molecular mechanism, or perhaps how are genetics impacted by this kinds of exposure? And it's obviously really, really important now. Over the last 10, 15 years or so, we've seen an increase in maternal drinking. It used to be, you know, only 5 or 6% of women in the United States were consuming any alcohol while pregnant. Now, the recent CDC data shows upwards of 18% of women in like the 35 to 44 age range. So typically educated women who are being told by the media and the internet that, you know, having a little bit of wine here and there can be relaxing and beneficial for pregnancy. And the science, however, does not argue about the safety of alcohol in pregnancy. It's very clear from the scientist's point of view that it is not safe in any amount. And the CDC has finally come forward and said that. But that's basically why what started this whole thing. It's been about 10 years ago, my laboratory started working in this field.
So certainly from a clinical point of view, in medical school, we're sort of taught not to promote drinking during pregnancy. But I guess when somebody asks a patient, for example, how much could I drink? Usually, you know, we say 0 is the best answer, but sometimes when they say they have a glass of wine or a beer, you know, we're not, you know, shaking our finger and saying, no, that's bad. So what you guys are saying now is that we should be telling them to abstain from alcohol altogether.
Olga, you can.
Oh, absolutely. Yeah. So I personally think there's a huge disconnect between OBGYNs and scientists, where a lot of OBs do tell their patients, it's okay to have a glass of wine here or there in your second trimester, in your third trimester. But what that means for someone who was a regular drinker before getting pregnant, a glass of wine here or there could be one for lunch, one for dinner, or one every other day, you know, or, you know, for someone else, it could be once a week, once a month. So a lot of factors come into play here, critical periods being one. The brain, of course, is developing up until 7 years old and beyond. Me and Kelly were just talking about this, up until 20 years old, really. So depending when you consume the alcohol and the amounts you drink really can have an effect. They may not be severe where you display the phenotypes, the facial phenotypes, or the severe learning disabilities, or the severe autism resembling type of phenotypes, but you can have other, I guess, temperamental deficits. So temperament being one of them, poor judgment, colicky baby, with the little amount that you are drinking. So yes, your child may not have mental retardation or something on the FAS severe form, but we do think as scientists, even if you consume a little here, a little there, there could be some adverse outcome associated with that in your child. Do you agree with that, Kelly?
Yeah, and we do have data to support this information. So there have been studies showing really even small amounts, and this is in animal models, for example, even, you know, a single dose of ethanol at a certain point in the pregnancy can induce changes in an entire class of receptors in the brain. You know, we have GABA receptors, which are very, very important for inhibition, and they play a key role in brain function in a variety of ways. And there is very clear data that maternal consumption of alcohol, even in small doses, can alter the development of this particular class of receptors in the brain. So when people ask me the same question, which I have been asked this many, many times, you know, okay, so let's say I have a few drinks in my third trimester, is this going to cause an effect? And my typical response is that most likely you are changing something in the brain of the baby, that even with a small dose. And there are a lot of things you can intake during the pregnancy that will also change the brain of the baby. Now, whether or not a few glasses of wine is going to produce a very severe phenotype has to do with a lot of other factors that unfortunately you don't know going into it. How well does the mother herself metabolize the ethanol? You know, her alcohol dehydrogenase levels in terms of enzymatic activity. How does that impact her being able to process and pull the ethanol from her own blood? These kinds of things all play a role, and we don't, as people, we don't know about that function in us. So there is no safe way to say, okay, I know that I'm okay to have this one glass of wine or not. And the data is really clear that, you know, you will change something in the baby's brain, whether or not that will read out in some kind of severe deficit, most likely not in low doses, but, you know, you go to any second grade class, first grade class right now in the United States, and what you'll see are children who are pretty off the hook. They're hyper, you know, they have problems paying attention in many cases, and they're not diagnosed with autism or ADHD, but along this kind of normal, within that normal range, but maybe on the edge. And it's quite possible, and I would even probably argue that some of these children who we see having these mild dysfunctions in terms of cognitive ability, fine motor skills or fine motor skill development, right? Temperament, the ability to emotionally regulate, like from keeping them from getting angry, that these kinds of things could be very likely from maternal intake when it was present. You really do need to have those higher doses to show the facial phenotype that's going to give that medical diagnosis of FAS, or fetal alcohol syndrome.
And it's important to mention that unless the mother actually admits to drinking alcohol, there is no diagnostic tool to measure, okay, this kid has FAS or FASD or partial FAS. So a lot of mothers wouldn't admit that, right? So
just to kind of define a couple of terms for people that might not know. Phenotype is referred to the physical features or the behavioral outputs that are seen in the children. So we'll talk about the specific facial features. The other thing I wanted to ask you guys, and I know from a clinical point of view, we just look at the physical features to say whether somebody has fetal alcohol syndrome or fetal alcohol spectrum disorder. So if maybe one of you guys could define some of these specific features that would be used to diagnose this, and I could jump in and give a couple of on my end. But after that, I really want to get into what you guys have done in terms of research to support the argument that you're making in terms of what you found from the animal studies and how the animal studies correlated with the stuff that we see with the children.
Well, we're not clinicians, so we're PhDs, right? So I don't know all of the details of diagnostic criteria for it. I do know that if we see behavioral phenotypes that occur in the absence of facial changes or they're almost like mild deformities in the face, that you have to really have the maternal admission of how much she drank during the pregnancy for them to kind of identify, let's say, hyperactivity as a result of fetal alcohol rather than a result of something like ADHD. Obviously, there are very, very specific facial deformities, if you will, instead of using the word phenotype, where we see the eyelid fissure, which is normally, mine is this wide. They tend to be smaller. And so it gives the appearance of a wider set eyes. There's also the dip in the upper lip is called our philtrum. And for these children, it's very, very smooth, almost flat. A lot of times too, they have an extended distance between the nose and the upper lip. So there are very clear telltale signs, but those are only there in that really, really high dose. And when I say that, it's interacting again. Okay.
Just a really quick thing. And you're absolutely right. Those physical features correlate with the amount of the mental issues that you will see. In other words, the higher the alcohol intake, the more prominent those facial features are and the more severe the mental issues are. So it's the physical features is kind of a gauge of where on the spectrum the child lies. So it's one thing that clinicians use to kind of measure how severe the mental issues would be when the child is first born. And obviously, the more severe form of it, fetal alcohol syndrome, which is the worst end of the spectrum, is the one where the facial features are really prominent, and you can say, okay, this child was born to a mother who had significant amounts of alcohol during pregnancy.
Well, and one thing that's interesting, though, again, it's not just like total volume of the alcohol. And that's something I think that is important, because if you are a pregnant woman who is fairly alcohol naive, so you're not a practicing drinker, so to speak, and you have, let's just say, a handful of binge experiences during the pregnancy, that even though the actual overall volume of the alcohol is not that much over a 9-month period, and maybe even the number of occasions is not that much. But if you're alcohol naive and your liver and other things are not used to working with the ethanol in your system, this is going to result in higher blood alcohol levels that are sustained for longer, which will have a greater impact on the developing fetus. So, and that's the thing. No one really knows exactly how well they do any of these things. So if someone tries to experiment, that's what you're truly doing. You're truly experimenting with your child's developing brain, which is why the CDC now has really clearly come forward and say no amount of alcohol is safe in pregnancy.
So I guess to just clarify myself, and you absolutely make a great point, it's not about how much the mother drinks, it's the amount of exposure that the fetus gets during pregnancy. And that has multiple factors, like you're mentioning, the liver enzymes of the mother, the timing of when they're drinking, and the critical period in which the development is happening. And when you drink during that period, it's more severe than if you were to drink it a little bit before or later, I guess. But therefore, you're kind of playing a Russian roulette with your kid's development by taking in alcohol. And the best thing is not to play that game and just abstain from it, right?
Right. I like to say that having 2 children myself, once you have the kid, your life is pretty much one big sacrifice to take care of them and to give them everything anyway. So you might as well just start 9 months earlier.
That's a big point.
A mild sacrifice in comparison.
Right. So can we go into some of the specific experiments you guys have done to back up this data? Because it's important, we agree on the no alcohol, zero tolerance policy. And this is what I think every physician should be promoting. But at the same time, the devil's advocate in me says, okay, show me the data, because I think that's what we should be basing it on, right?
Okay. Well, what I'll do is I'll start off with a little bit about our original model and our original papers, and then I can have Olga talk about a couple of her papers specifically that were a part of the overall project in the laboratory. So as I mentioned, around 10 years ago, I think it was around 2009, with my very first graduate student, we began this quest to develop a mouse model. Other mouse models had been made previously in different strains of mice. We had done a lot of work in an outbred strain, which means that the genetics of each individual animal are not identical. A lot of people in molecular biology prefer to use mice that have really identical genetics, and they're inbred strains. But what we wanted to really create something that would be applicable to humans. And as humans, we are absolutely outbred strains. So we wanted to use this particular strain of mouse called the CD1. And so we began working on that. Once we got the animals to breed with the maternal consumption of alcohol, we sort of settled on a percentage. And these animals drink 25% ethanol once they become pregnant. And that may seem like a lot, but mice metabolize ethanol at a rate tremendously faster than humans. So when we talk about our mothers, we call them dams, these mouse pregnant mothers, the dams maintain blood alcohol, what would be equivalent to about a 0.08, 0.07 in a human. So what that kind of means is, right, a couple of drinks in your system. So it's, even though 25% ethanol in that nonstop sounds like a ton, at the end of the day, what we're really talking about is about a mom who's drinking daily, right? Keeping her blood alcohol at some level throughout the day when she's not sleeping. And this absolutely is within possibility that can happen. Now, when we started, we wanted to hit it with as much ethanol as we could because we wanted to see what kind of phenotypes we could find. That's why we do have somewhat of a high dose. Eventually, we're starting to do some work now where we're decreasing dose, limiting dose to different trimesters and things like that. But in our original model, which we have worked with now for 10 years, is this sort of 25% ethanol. And in our first group of papers, we found some really very exciting things that were shocking to the field, particularly that the way that the brain, particularly the neocortex, which is of course the wrinkly part of the brain. When you see an image of a human brain, it's that wrinkly thing that sits on top. And this is the part of the brain that makes us uniquely human. Its function gives us sophisticated behaviors, complex cognition, language, a lot of memory, intensity of emotion, and everything that makes us human, uniquely human, right, has to do with mostly our function in the cortex. So it's obvious this is a place where when we look at children with FAS or FASD, we can see that they clearly have dysfunction within this part of the brain because we see these deficits in fine motor skills, in emotion regulation, in cognitive performance on task, or their ability to learn complex behaviors. So we started right away.
Sorry, not to cut you off again, but just to clarify, so you've taken mothers that became pregnant and then it gave them alcohol, and then once the offspring was born, you put them through a battery of tests that measured all of these stuff, and you also looked at their brains to look for morphological changes, right?
Yes, and molecular changes as well. So, right. So in that first model, we looked at particularly how the cortex was wired up. So in order for me, for example, to sit here and be able to talk and move my hands and to create, lucid thoughts and express them with language, I'm activating these many circuits within my cortex. And we're doing this all day long with all of our behaviors. And our hypothesis initially was that there would be a disruption in the development of these circuits in that part of the brain. And we did find that indeed to be true, that on the day of birth, when we would, sacrifice these animals, examine their brains, that they had this disruption in the normal development of the primary circuit that allows the animals to navigate through their environment. And this was very, very exciting. We then followed this up with sort of mechanistic studies to understand, okay, what is it? How are these, what is the mechanism by which these connections are malforming? And we found this to be altered gene expression. So one thing that in terms of how the brain develops, it is patterned by genes turning on and off in specific locations at specific times. So when we see shifts in gene expression because of altered programming in some way, that can lead to problems with development of connections or the circuit in general, which ultimately we hypothesize would lead to atypical behavior. So that was our first finding, and it was very exciting. We were able to look in that newborn mouse and find these molecular alterations in the brain, meaning the genes were not expressed in normal patterns. The connections did not form in a normal way. And then at around 20 days around weaning, we tested them on a battery of behavioral assays and found them to have abnormal behavior, particularly things that are consistent with what we see in humans: increased anxiety-like behaviors, errors in motor skills, or what we call sensory motor integration, which is your ability to integrate information coming in through the senses as the animal's like walking on a little bar, and then they have to adjust their motor performance so they don't fall out or fall off of the bar. Those kinds of things were disrupted in our alcohol model. So that was our first big paper published in Journal of Neuroscience in 2013.
That's really exciting because it really clearly demonstrates that the alcohol affects specific genes and genes that are important for patterning and formation of the brain. And you could explain sort of the behavioral outcomes based on the molecular stuff that you're seeing. So it's definitely a very strong evidence about the effects of alcohol during pregnancy.
Right, and then another, you know, we've had several studies on this model, but I want Olga to have a chance to talk about a study in her older mice. A lot of our work is focused on the molecular work in a very newborn, because that's when the genes are most robustly expressed, and we can really see that better in the newborn. They're patterning genes, so once the brain becomes developed, we see those things fade, and we aren't able to identify those phenotypes as well. So Olga did a really fantastic study on fear conditioning in the adult animals that I want her to have a chance to talk about as well.
Thanks, Kel. Yeah, so I was mostly, I guess, interested in the long-term effects of in utero exposure to alcohol. So one project that I worked on with, you know, really interesting results is we keep talking about, oh, children with FAS, they have learning disabilities and all that. So how do we actually model this in animal models to really learn what's going on in the brain for children to have these learning disabilities? So like Kelly talked about, we exposed our mice to 25% alcohol when the mom was pregnant. So the child was born with FAS. And then I let my animals grow up to be P50. This is equivalent to about young adulthood in human life. So at P50, that's where I began my experiments of fear conditioning, where we actually exposed the animal to, we put them in a chamber and we exposed them to a tone and a foot shock within 2 seconds. So they're learning that if I hear this tone, I'm going to get foot shocked. So there's an aversive stimuli coming my way. So, and then the outcome would be freezing behavior. Once they hear the tone, the expectation is for the animal to freeze because they're afraid, right? So once we do
it's like
this
Pavlovian conditioning of the shock,
right,
with the freezing response.
Right, right. So once the conditioning is finished, they form this association in their head. If I hear this tone, I'm going to get foot shocked. That's when we do the testing. So I did testing in 2 developmental time points, conditioning them at P50, which is, like I said, early adulthood. And I tested them at P52, which is, again, early adulthood, and P70, which is later on in adulthood. And both at P52 and at P50, where we expose the animal to the chamber and only give them the tone and no foot shock at this point. So like I said, they've made the association. I hear the tone, I'm going to get foot shocked. But they hear the tone, they don't get foot shocked. The outcome is to freeze again. And we saw that these animals at P50 and at P72, or P52 and P72, don't freeze. So compared to their controlled naive counterparts, where the controls hear the tone, they automatically freeze because they're like, oh my gosh, I'm going to get this aversive stimuli. I'm going to get foot shocked and that's going to hurt. These Cree animals just weren't freezing. They weren't recognizing the fact that I hear this tone, I'm going to get foot shocked and it's probably going to hurt. So what is actually happening in the brain? I looked at several, I guess, neuroanatomical components of this, one being the amygdala. The amygdala is typically our emotion center, but it's also where we make these associations, where learning actually occurs. Associations between a tone and consolidation of the tone and the aversive stimuli coming together. So what I found is when I took the brains at P52 and P70 is that at P50, actually no, let me backtrack. I took the brains at P50 in a separate cohort of animals because it's a whole different paradigm or a whole different experiment when they actually go through the test. At P50, when they're actually learning the association between the tone and the aversive stimuli, the amygdala is actually a lot smaller. So I can't really speak to the functional outcomes of that, but we know that neuroanatomically speaking, the amygdala isn't, I guess, as developed as it should be compared to their controls. So,
I mean, I guess this is a great piece of data because it shows that, I guess, and correct me if I'm wrong, that their learning and association between fear and a stimuli is lacking. And if I remember correctly, kids with FAS have impulsivity issues, and so they are more likely to get into trouble because they can't really control themselves. So they're not able to, in some ways, associate the dangers of their actions with the outcome. And you guys can correct me if I'm wrong.
Right. This does definitely translate into that kind of, you know, if I misbehave, I'm going to get reprimanded for it. But someone who has FAS or can't make that association, if I misbehave, I'm going to get in trouble for this. They're more prone to taking risks and just acting out and not recognizing that they're going to actually get in trouble for it.
And so with the smaller amygdala, it kind of shows that there's an anatomical reason why the behavioral outcomes we're seeing.
Right, and
Right.
we see as well in another assay called the elevated plus maze in our mice, we see what many would identify as decreased anxiety, which is, this is a little maze, it's a platform where the animal, the mouse, can either hide inside a closed tunnel or be out in the open. And we know these are rodents, they are prey animals. Typically, if they have any kind of anxiety at all, the idea is that they will go and hide in the enclosed tunnel. What we actually saw was the opposite in our fetal alcohol mice, in that they would spend more time out in the open. And we just, you know, I thought a lot about this, and I absolutely do not believe this indicates that they have lower anxiety. What it indicates is that they have higher risk-taking behavior. And the reason they are having higher risk-taking behavior is because, like we saw in Olga's study, they aren't learning normal fear responses as a normal prey animal would. And, you know, again, how does this map out into humans? When we look at cortical development and brain development in human versus rodent models, one thing that the general public a lot of time doesn't understand is that there are tremendous similarities, particularly with how the genetics pattern the brain early on in development. A lot of the same genes are going on and turning on and off in these discrete locations in the human and in the rodent brain. This is why rodents are actually a very good model for human neurobiology in general, because of those similarities in genetic patterning that goes on in development. So, you know, I think it is really consistent. I think when we think about humans with fetal alcohol effects, whether it's severe or even more mild, we do see these higher risk-taking behaviors. We do see what seems to be the inability to learn normal fear responses. And I think it's coming down to perhaps this really deficit in development of the amygdala. But also, you know, we also see in another study we have done with Olga that isn't yet published, where we did more anatomical measures in older mice as you know, who were a part of this model. We found things like, even later on in life, decreased spine density. So little spines are on the neurons that affect their communication. And we see deficits in that are maintained long-term. Also, we see some long-term changes in gene expression as well. So all of these things together could work together to produce these effects, behavioral effects, whether it's decreased fear learning or more, you know, being more clumsy, having difficulty with fine motor skills. And then of course the huge different types of cognitive dysfunction that we see, you know, is most likely from these mechanisms that underlie brain development that are altered with the alcohol exposure.
Very, very interesting. So Olga, you were talking about the two different sets of experiments, and you said you measured them in adulthood. And can you go a little bit more detailed in some of the other features that you saw neuroanatomically?
So we did publish a paper actually where we mapped out the whole, I guess, anatomical trajectory of the cortex and subcortical areas. So what that means is the wiggly part of the brain, which has different components that are responsible for your vision, for your senses, for your decision making. But also we looked at different subcortical regions, like areas associated with memory, like the hippocampus, areas associated with like the amygdala with emotion. And what we see is, without getting into too much detail, we looked at ages P0, P20, and I believe P50, which is birth, early pubescence, and early adulthood, where the trajectory of development of these key brain regions in your area is altered in FASD. So compared to their controls. So when the nuclei or the certain brain region should be developed at a certain rate, either is slowed down or is accelerated, which of course can have functional outcomes. Again, I can't really speak to the functional outcomes, but because we see a neuroanatomical change in this trajectory, I believe it is safe to say that there is some sort of maybe adverse outcome that comes with it.
And sorry, no, I know that, you know, GABA is very important during development, and this is one of the receptors that alcohol binds to. And, but of course, alcohol could do many, many different things in terms of its promiscuity, if no pun intended. But so do you guys know in terms of molecularly what specifically the receptors or the molecular changes that it's doing in that context?
So, yes. Well, I mean, certainly not everything. I mean, I think there's a lot of things that are undiscovered still about this. And you're right that alcohol, you know, alcohol, we take it in systemically, right? So we're drinking it, it's affecting our gut biology, right? Absolutely. And it's doing a lot of different things throughout the nervous system and other parts of the body as well. And the body is definitely whole. So I think that, you know, we focus on the neurobiology of it, but I would definitely believe that especially something like what's going on in the gut as a result of alcohol would also impact development or just function in the brain in general. But specifically to answer your question, after we found some of our early studies where we published these effects in gene expression changes as a result of prenatal alcohol exposure, we started to kind of, you know, group think about what could be the mechanisms that would be able to generate the change in the gene expression, right? So this is RNA expression, and we wanted to find out exactly, you know, what is the mechanism. So one of our early hypotheses, which turned out to be correct, was that DNA methylation can change from consumption of alcohol. What this is, you know, everyone, probably all of the viewers know what DNA is. It's this double-stranded helix with amino acids. And basically, to not get too technical, we have little methyl groups that bind to our DNA, okay? And what these things do is they don't change the sequence of the DNA, but they change how the DNA functions in the body at any given time. So they control kind of how genes turn on and turn off. And so we know that changes in methylation, or how those methyl groups are bind to the DNA, that those changes can alter gene expression, particularly in development. So we had probably our biggest paper in terms of notoriety and fame, if you will, in the science world, would be our work that was published in 2018 in the journal Cerebral Cortex. And in this paper, we first began to investigate DNA methylation in this model. And we did find very significantly that alcohol intake, and there's a very complicated pathway that has to do with 1-carbon metabolism, for example, that alters the methylation. We found that in the brains of the offspring that had been exposed to ethanol during development or during pregnancy, they had decreased methylation, and this decreased methylation was gene specific. So when we found that, it was specific for the genes that we found to have those altered expression patterns. So we were able to identify this mechanism, which was really fantastic. And what's really interesting about this is that typically these changes in methylation, although they are not changing the sequence of the DNA, they change the way the DNA functions, but they can stick from generation to generation. And this is what's really, really important. There had been some studies earlier suggesting that subsequent generations of animals exposed to ethanol during pregnancy, that they had some behavioral effects that seemed to be passed on through the generations, but that was pretty much the extent of the knowledge in that entire area. once we discovered that the methylation was changed, leading to the change in gene expression, initiating the change in the abnormal development of the connections or the circuits, that's when we created our transgenerational model. So that was really, really made a big step in the field, I believe, because we were able to demonstrate that not only are the offspring of the mom who's drinking during pregnancy impacted, but their children and their grandchildren are impacted by just that one single maternal exposure. So in the absence of any other additional alcohol exposure, these animals, as they pass through the generations, are affected, showing these behavioral phenotypes, showing brain phenotypes as well that look a lot like animals who have been exposed to alcohol. So this is really, really, it's one of those things. It's really exciting for science. It was fantastic for our laboratory that we were right, and all of that. But it was one of those things that was also kind of sad for humans, right? For people, because if let's say you're someone whose mother drank during pregnancy and you do have some deficits because of that. I mean, knowing that no matter what you do or your child does, that your child and your grandchildren could be affected could be really disappointing and sad.
So this is very exciting stuff because I had made a prior episode on transgenerational transference of anxiety and emotional stuff in general. So now this ties in with the alcohol consumption, which brings into the question, well, it's not just the mother. The father has a contribution too if their alcohol consumption is significant, or they come from a generation of alcoholic parents, for example, right? So this then brings in a second factor that we've been talking about maternal drinking, but there's also the paternal contribution to this whole thing.
Right, and we just published a paper 2 months ago, I think, on this very topic. So when the CDC came forward and said, this was a few years ago, no drinking in pregnancy is safe, that was great. And then they made this point that if women are sexually active and not on the birth control, that they shouldn't be drinking at all. This kind of created a little bit of an uproar in, particularly feminist America, saying, well, what about the guys? And I still can remember I was driving my little Fiat to work and I thought, I need to figure this out. We need to create a paternal model. And, we did. So we did, and we just published this paper in the journal ACER, which is Alcoholism, Clinical and Experimental Research. And we found really some exciting stuff. Basically, we exposed the males for 2 weeks to the same high dose of 25% ethanol. And at the end, we obviously, after 2 weeks, we removed them from alcohol, put them with the female. We had to remove them because we didn't want her to drink anything, right? So anyway, their offspring were absolutely affected. So it was really, really exciting to see how some changes in most likely methylation in the sperm, which has been shown to happen, that has been shown by others, where high dose of alcohol in a male can affect the methylation profiles in his sperm, that this could actually alter the developmental trajectories of the offspring he produces the moment he breeds after having this period of high alcohol exposure.
If I could ask a quick question in regards to that, because again, to play the devil's advocate here. So we know that any kind of fear stimuli or nauseous stimuli in animals, it's been shown that it causes anxiety and sort of terror. And so this has been shown that they could pass it on to several generations. So in that regard, do mice enjoy alcohol? I mean, or is this, when you're exposing the male or in the female, is this a nauseous stimuli that they're taking in that is being passed down, or is there evidence that, I mean, I don't know how you would measure if mice enjoy it, but I guess if they're addicted to it, that means they enjoy it, right? They're not fearful for it. So I'm wondering whether the transgenerational stuff is a relation to a nauseous stimuli or it's an actual alcohol effect.
Well, we know that the alcohol causes this demethylation. I mean, so we do know that. I definitely don't know whether or not, you know, how the mice feel about it. I don't know the mice have that kind of sort of cognitive, you know, but I don't know, Olga, you would probably know if there's two place preference, would they prefer the alcohol? I think they do, right?
Yeah, they do prefer the alcohol, but I guess in like the F1 generation, so the mother that's directly been exposed to the alcohol, because we are kind of hitting them with this whole gestational model of alcohol exposure, they're not going through withdrawal, which comes with different effects, right? So the anxiety, the stress of not having the alcohol or whatnot. So I think we can eliminate the fact that the mother's having withdrawal symptoms or anxiety or stress coming from the alcohol that she's passing on to her offspring, because she is on the alcohol the whole time and is feeling good.
Okay, so then it is definitely exciting stuff, because it's showing us that, you know, even grandma and grandpa could have contributed to some of the stuff that we're seeing in the offspring. So then I want to ask, what can be done? Are there ways to kind of help these individuals, kind of interventions, things that could be done to maybe make early diagnoses, ways to block the methylation or alter the methylation status, or even behavioral things that need to be done early on to help with the kids that are born?
Well, I'm very excited you asked that, because we just had our paper accepted to neuropharmacology. Yeah, the Journal of Neuropharmacology. Brand new. We just got it accepted a couple of weeks ago. I think it's been published now. And this is on our choline model. So choline is a supplement, not too far off from something like folate or folic acid, which we know is important in development, particularly for closure of the neural tube in development. Choline is something that does alter that one carbon metabolism and seems to have ameliorative effects on those phenotypes that we see in mice exposed, or there's a couple of different rodent models before us that would show some behavioral release or a relief from behavioral effects of alcohol that was exposed during the prenatal period. We did a very extensive study. We had some good idea, again, because we know that that methylation could be altered and improved by high doses of choline that would be administered along with the ethanol, okay? So, and we found really, really fantastic effects that it pretty much rescued, in some cases completely. When we see the changes in methylation, we see a complete rescue of ethanol's dangers, right, or bad effects by giving the choline along with the ethanol. We see that rescue. In terms of the aberrant connection and the patterning, it's a partial rescue. So we see that when we look at controls versus ethanol with choline don't have a complete rescue, but it's about 50% improved or so in terms of those altered connections. And we also see these rescuing of phenotypic effects. But most importantly, I think, rather than just thinking about how the brain is improved, is the behavior, right? And we do see pretty much across the board, we see this improvement in behavior, these long-term behavioral outcomes from the ethanol when the choline was co-administered with the ethanol in pregnancy. And this was particularly pointed actually for females, because we did, now in our studies, we're being very careful in separating out, because there are some differential effects in males versus females. So this was very exciting for us, because it does provide a kind of, we like to call it a preventative cure. We haven't tested whether or not the animal, who's just been exposed to ethanol, whether we can give choline once they're born to try to repair some of the damage. We haven't done that. We've administered it along with it. So if you think about, if this is very important for someone who maybe is an alcoholic, can't stop, even though maybe she knows she should, but she can't stop, she could take choline supplements during the pregnancy to help thwart some of those negative effects of alcohol.
So I can imagine this being as one of the, supplements that you take, or with the vitamins that most women take if they want to get pregnant, to kind of, just like folic acid, for example. And so you could throw this in as a cocktail of one of those vitamins, just in case she happens to have a drink. So do you think like adding choline as one of the supplements that
would be great? You know, occasionally you will see on some prenatal vitamins, you will occasionally see some small dosing of choline in there, but it's not as pervasive, or it's not considered as important as something like folic acid, where, you know, doctors will go out of their way to say, you know, make sure that you're taking your prenatal vitamins because of the folic acid, because we have this very, very strong link between low folic acid levels and, you know, spina bifida in babies, for example. You know, it's interesting because, you know, in our diet, most people have a good amount of folic acid in their diet, so it's probably not as important. But certainly in developing countries, it absolutely is. And even in parts of Asia, the government will fortify the flour with folate. And I think you know, we really do need to make the medical public aware, particularly OBGYNs, that, you know, if you do, you really need to talk to the moms about their drinking, advise them, but, you know, be sensitive as a physician to understand, you know, are they getting nervous when you're having this conversation? Are they being combative? Are they trying to look for reasons why they can drink? And if so, maybe encouraging them to take the choline. But I want to make it clear that choline is, I mean, it's not 100% preventative. We do see rescue, but it's not 100% rescue on all of our biological effects. So
and I did want to add on. I didn't want to add on to the whole choline. Of course, choline is great, but if you do have a child with, you know, you did drink and your child does have symptoms of FAS, there are studies that show that environmental enrichment, you know, if they have fine motor skill deficits or sensory motor integration, balancing or whatnot, if you give them the tools, whether it's Montessori toys or dance classes or, you know, cognitive development learning stuff, there is huge evidence out there that says that children can catch up and can actually improve their deficits based on their environmental enrichment and the tools they're given.
So that's exciting as well, that if you catch them early, there are interventions that could be done. And of course, but there is no diagnostic test, right? So it's essentially facial features and behavioral stuff. So Olga, what are some of the different diseases or behavioral stuff that FAS could be confused with, and whether it really does matter to diagnose somebody with one versus the other in terms of those interventions that you talked about, or you don't think there are any?
Yeah, that's a great question, because if, like I said, if the mother doesn't admit to drinking alcohol while pregnant, it's hard to diagnose unless they have the real severe facial features. But autism is one. Autism is also a spectrum. FAS is also a spectrum. So the cognitive deficits that are associated with autism, maybe children diagnosed with Asperger's, and versus children with cognitive deficits with FAS that have been exposed to alcohol when, you know, they were in utero. A lot of these effects overlap. So a lot of children with FAS, I think, could be misdiagnosed with having autism or Asperger's or being on that kind of spectrum because the mother didn't admit to drinking the alcohol. So I think it's important, like Kelly said, to have these mothers, to educate them and you know, it's okay to tell your doctor, yes, I did drink. You know, the consensus is that zero alcohol, you know, no amount of alcohol is safe. But in order for your child to get diagnosed properly, I think it's important for transparency to be there. So yeah, you know, there's huge overlap in autism or ADHD. You know, a lot of FAS children display hyperactivity and, you know, can't sit still. A 5-year-old in the classroom can't pay attention. So they often get diagnosed with ADHD if the mother didn't admit to drinking alcohol. So it's important for transparency to be there for appropriate diagnosis purposes.
Right, and for treatments, because that's important with, you know, we have very clear treatments for ADHD. Right? We have psychomotor stimulants, for example, Ritalin, Adderall. These things are not going to work. They're not going to work on a child who is showing that sort of hyperactivity from alcohol exposure. Yeah. It's different, you know, the idea, the smart money is really on that it's a different mechanism that leads to kind of similar looking behaviors in the end. And that it, but so if, when it's a different mechanism, that means there are different causes for the behavior, then the same treatments are not going to work the same. And something like that where, you know, you could say, oh, you know, I don't know why, you know, Ritalin's not improving my child. Well, it could be that what they don't really have, they're not on the hyperactivity spectrum, they're on the fetal alcohol spectrum.
Right.
So in regards to that, I was just thinking in my head, so you found these methylation differences that you say is transgenerational. So could that be used as some sort of a biomarker to not maybe even diagnose FAS if the methylation pattern is prominent in there? For example, the blood cells or skin cells that could be used to look for this methylation pattern and then say, well, this is different than autism or another neurocognitive deficit disorder, and be able to really hone in on, okay, this is FAS or FASD.
Well, our methylation changes that we find are specifically in brain tissues. So obviously that makes it not possible as sort of using it for diagnostic purposes. I don't, you know, especially because we're looking at it with using something called methylation specific PCR, which is to really look at how 4 given genes, which are involved in patterning in the brain, within brain tissue, how those methylation profiles are different. So I don't know how that, I actually don't know how that would read out in changes in other kinds of body tissues, such as blood or skin, that could be readily used for testing. I really don't know the answer, because all of our work is done specifically in the brain tissues, and even region specific, right? We'll take samples from the front of the brain versus the back to look at the sort of regional differences in methylation change as well.
Go ahead, Golda.
I personally think, so this is all great, right? But remember, Kelly, when we did another interview with HuffPost and we were talking to these blogger moms and they're like, well, when I drink alcohol, I feel good, so my baby feels good. There's this kind of misconception going around where it's like, if I'm relaxed, my baby's relaxed, so if I'm feeling good, it's good for my baby. I think us as scientists, as clinicians, what do we do to change people's perspective on this stuff? You know, we can educate them, but because I often come across people who, you know, are drinking in my presence, and I will tell them, you know, you probably shouldn't have that drink. But it's like this, there's a defense mechanism. You know, they go on the defensive. Well, why not? You know, I'm craving it. You know, it's a pregnancy craving. That's why I'm drinking. So what do we do as, you know, kind of pioneers in the field to stop this kind of thinking process?
Yeah, that's a good question.
Yeah.
And it's interesting you know, there's worldwide, there are a fairly good sized group of scientists who are studying this. Particularly people from Australia and Canada also, where the FASD rates are quite high. And what's interesting is there's actually a movement in the field not to shame. And because when you were first talking, I was thinking, well, really the only way to really motivate them is through fear. Like say, if you do this, then you will be punished with a baby and you're hurting your baby, and really kind of shaming them into not doing it. But in the field, there's really a movement to stop shaming women for this behavior. So it's an interesting conundrum that we find ourselves in, because if we don't want to shame them, because we want them to come forward to get help if this happens, or for them to say, I can't stop drinking, so can you help me? And we can suggest, you know, other sorts of diets or supplements or whatever to help them, or even to get the diagnoses accurate so that the children can get that enrichment that they need. So we don't want to shame them, but, you know, fear is also a powerful motivator, right? You know, when I was pregnant, I absolutely I didn't drink, but something like taking Advil, you know. I know that Advil can cause increased bleeding, and, you know, and all these other effects. So I absolutely did not take Advil. And you know, a lot of these women, they won't take Advil. And in many cases, they won't smoke. Cannabis aside, because that's another new issue that we now have with people thinking that cannabis is okay to do during pregnancy. But yeah, it's a good question. And I think we can try to educate. And it's very important that we educate the doctors. We do start there, because if they are telling people, and I have, you know, I'm many of my friends, of course, have children, and they were told, you can drink a little here and there in the third trimester in particular, which is maybe not the time where those key parts of the brain are developing that are responsible for your breathing or your heartbeat or major sort of body functions, but that cortex is strongly developing at that time. So if you're taking an alcohol in the third trimester when the cortex is developing, remember that's the part of the brain that is responsible for our sophisticated behaviors and our complex cognition, what allows us to be engineers and mathematicians. That part of the brain is important too, maybe not for clear survival, but for the big ability to have sort of normal and optimal development, I think we could say.
Yeah.
And I also would say, like, would you give your baby some whiskey in a baby bottle? Of course they wouldn't, right? So it's really not different. And I think people need to understand that.
And I think part of it is really education and getting it out there, because, there's obviously, everybody knows getting drunk and driving is a bad thing, and there's a whole huge movement about preventing drunk drivers. And I think there should be some kind of a movement like that about mothers against mothers drinking alcohol, for example, during pregnancy, something that lets people know, educate them. And I think there is not a lot, and most people don't understand it because there's not a constant exposure about the dangers of this in their mind, in terms of advertisements and presentations or even pamphlets that should be made to be handed out during pregnancy.
And if you Google, "I'm pregnant, is it safe to drink?" actually several of the first few sites that will come up will say it is. So
wow. That's
going to the internet
things that need to be changed. And I looked at the numbers. It's quite fascinating that FAS and FASD are much higher prevalence compared to autism and some of the other neurocognitive deficits that we see. It's almost like tenfold higher, and yet there's not as much attention brought to it, and not much is being done in terms of public awareness about the consequences of drinking while pregnant. And the fathers too. I mean, if you're considering having a child, then maybe you should abstain from very high levels of alcohol, either before or right before you're considering having a child.
Yeah, it's probably safe to detox a couple of months before conception.
Right, but that's not a very popular thing,
right?
With the guys, right? And when we were first embarking in this field, I remember when we found our first phenotypes, I thought, oh my God, this is going to be so great. It's going to be in the news. And it was in the news, but it wasn't in the news as much as, a Denmark study that showed, from their metrics that it was safe to drink in pregnancy. And I think especially in America, the land of free choice, people don't like to be told what you can't do. People like to be told, do whatever you want to do. It's good for you. Make yourself happy, right? That's kind of our culture now, unfortunately. And unfortunately in some cases. So people are very good at focusing on evidence that supports their view, that allows them to do what they want to do. And, we also see the highest cancer rates of all time, right? So, and a lot of this has to do with people really, it's that hedonistic lifestyle and not willing to make sacrifice. And like I said, I think for children, I guess now if you're a strong alcoholic, it's very difficult to stop drinking for 9 months, for sure, no doubt. But for a lot of times it's not alcoholics, it's women who, drink socially or.
Well, that's the thing, right? Like, to add on to that, that's the thing. With alcohol, it's such a complex topic. It's because that's how we socialize as adults, right? It's socially accepted to drink. It's not really socially accepted to go out and smoke cannabis or, to do other sorts of drugs or whatever that will hurt your child developmentally. But because alcohol is socially accepted, it's kind of like an easier drug to have access to and have it socially acceptable to consume while pregnant. So
I think we will get there with cannabis, unfortunately. I mean, I remember not that long ago seeing on a mom blog kind of Facebook page where it was, is cannabis safe to do in pregnancy? And I was blown away out of the 600 comments how at least 75% of them were saying absolutely, maybe not if you smoke it, but if you eat it, if you do some drops of the oil or whatever, or have a brownie, that it helps calm you down, and it's natural, it's from the earth, it's very
I mean, so is lead, but nobody says lead is good for you, but
that's true. That's a good point. Yes.
I mean, I just feel like there needs to be more outspoken scientists and physicians when it comes to this, and really, I think part of it has to do with making a hard line. If you say you could have a drink here and there, no, it's zero alcohol during pregnancy, and that should be the policy of every OB-GYN or every physician. And clearly, you guys have excellent and fascinating data to show that. And not just you, but the whole field is kind of going towards that way. And just also, it's not about just your child, but your grandkid and their kid, So it's multiple generations that you're affecting during that 9-month period where, you could be doing the right stuff. So,
true. And it's the importance too of listening to the science. I think that's what's really, really important, because culturally we see, I think, a move against science in this country. I think we see people, relying more on anecdotal, information, and, oh, well, my cousin, she drank a lot and her kid's fine,
Yeah.
And remember, we can't go back and do the experiment to see maybe that child would have been the next Einstein, and now he's not, right? So we have to understand that science is not motivated, it shouldn't be, and at least in academics, it's not motivated by greed or any of these other things, but finding out the truth. So, we have to relearn as a society to trust the science and not the Google, I think, and not just what someone says in a tweet or a Facebook post.
And I think also part of the confusion is we physicians and scientists that we don't do, and it causes confusion, is they'll see a news blurb that alcohol drinking is good for blah, blah, blah. And then another study would come out, show that there is no effect. And then another study would show the opposite effect. And people are hearing these different things. And of course, the way the mind works, they're always going to gravitate towards the study that showed them what they wanted to hear. And they don't see these other stuff. So we should be careful, I think, as scientists and physicians, when you publish clinical data or any kind of data that shows a positive correlation, and then another study that shows a negative correlation, we should be summarizing these and saying, hey, the answer is not known, or look, these clinical trial data showed one thing, but these are the caveats. So we don't do a good job of explaining to the public about the results, and sometimes they're not really 100% truths. It's just the facts that might not be the case in a larger study.
Yeah. And that's the thing about explaining results. I feel like us as scientists, yes, we do the research, yes, we publish papers, but a regular person, chances are they're not going to go on PubMed.com and download our publication and read what's happening. So I think us as scientists, we need to do more blog posts, put our information out there in more readily understandable ways, so that a regular person, A, would have interest reading it, and B, understand what they're reading, really, without all the jargon that we throw in there. This is why we're doing this.
Yeah, this is one of the reasons I started this, to bring in people like you guys who have done incredible work with the sciences, but explain that to the people that don't understand it. And it's put it in a way that we guys have been doing really wonderfully, so that the general public understands and can relate to it and start thinking about it themselves and be more critical. And of course, on an important topic like this, it's really important that the public understands the data.
Yeah, and what's really interesting about it is that, millions of dollars of grant funding are going towards studying this to try to understand the development of fetal alcohol spectrum disorders, when in fact there's a cure, a preventative cure sitting right in front of us, which is to abstain. And that's the interesting thing about it, is that I'm dedicating my life's work to something that if people just chose to not drink, it wouldn't even be an issue.
I think there's hope though, because if we look at cancer rates, lung cancer rates among the teens, smoking rates and the cancer rates of lung cancer, it's been declining. So it looks like the education of the teenagers about abstaining from smoking is really having an impact on their smoking rates and the resulting decrease in lung cancer. So hopefully with more education, the abstaining from alcohol during pregnancy will also go in that direction. But I think it'll take a long time, and we still need ways to help those kids that are born with it. So it's, I think the research you guys have done with choline, and again, by no means that should promote people for drinking, but at least there is some intervention that could be done. And also the behavioral stuff that Olga was talking about in terms of intervention are also excellent ways that we can hopefully try to rescue some of these defects in these children as they're going into adulthood. Now, I do have one last quick question. Do these kids that, or at least also in the mice, when they're born from FAS, are they more prone to having tendencies to drink alcohol later on? Are they sort of more addicted to it? Or in humans, are they more likely to become addicts of some kind?
Our studies don't address that directly, but certainly there's human data to show that children of alcoholics are more prone to drink alcohol in their lives. However, it's confounded by experience, right? So a child who's growing up around alcohol is going to, and watching, their parents do it or whatever, they're going to be more prone, like in terms of just the learning environment, not necessarily something that is transgenerationally mediated, or even just from the direct effect themselves. But, maybe Olga, you're more familiar with literature on the addiction literature later on with experience.
Yeah, there's definitely a genetic predisposition to having an affinity towards alcohol when you're genetically exposed to it. And we do see that in animal models. So there's a higher risk of becoming an alcoholic if you come from ancestry of alcoholics. But that doesn't mean you are going to become an alcoholic, but you have the predisposition. So depending, when you're a teenager and you start kind of experimenting with your friends, if you do have a predisposition, there's a higher chance of you kind of getting hooked on the alcohol, just like any other drug. But yeah, that's generally the consensus.
So this has been an awesome discussion. I've enjoyed it very much. I think I've learned a lot myself, and hopefully it's going to be educational for the public listening to this. So if you guys have any last remarks before we come to the end.
Just that, I would say, in terms of that hard line, it took the CDC, the Centers for Disease Control, it took them a very, very long time to draw a hard line. And they finally did it a couple of years ago. And, I think that should be followed, and understand that it really did take them a very long time to come to it. And there was so much data backing that statement up that finally they had no choice but to really, truly say that there is no safe amount of alcohol to consume in pregnancy. And I hope that women can get help if they need it, right? And do their best to really, really abstain for the health of the baby.
All right. It's just 9 months. You can do anything for 9 months. And, it's not just about you. It's about your baby's future. So don't succumb to temptation. And yeah, look at the evidence, because this is all evidence-based. It's not anecdotal. And that's where we need to make the shift, going from my aunt drank, my sister drank, my niece is okay. That's
everyone
not okay.
In Europe, that famous one, everyone in Europe drinks. Right?
Or everyone in China or Japan eats sushi, right? So their kids are okay. We can have tuna or raw fish or whatever.
Right.
Well, I want to thank you both for taking your time and doing this. And hopefully in the future, we'll have another such interview where there is more positive outcome in terms of the work you guys are doing in terms of educating the public and declining rates of FAS. And I'm really interested in the transgenerational stuff. So maybe in the future, we'll also have a specific discussion on that topic itself. So with that, I want to thank you both. And once again, I appreciate you guys coming on and giving us your expert opinion.
Thank you. Thanks for inviting us.
Yes, thank you for inviting us. Spread
All
the
right.
good word.
Thank you so much, guys. Have a wonderful day, and I'll see you hopefully on another show.
Okay.
Bye-bye.